know that they're diabetic don't know that.
Now, I've been reading about DKA, diabetic ketoacidosis.
Pretty much, like I said, you pretty much smell it. You know,
Oh, okay.
the moment you, it's hard to describe it until you're actually there. It's like you know what gas smell like. Not
Uh
saying it
huh.
smell like gas, but you
Okay.
know the smell of gas. That's you automatically know when there's an issue and a
And
insulin problem in the
uh-huh,
body.
in the body.
Yes,
Okay. All right.
gas was just an example.
Okay. Now, triggers may include infection that can lead to diabetes type 1, not taking insulin correctly, stroke, and certain medications such as steroids. And they can lead to the DKA, as they call it.
Okay,
Uh-huh.
I do know insulin. People who don't take diabetes seriously it's a very serious disease to have because it can lead to heart attacks and strokes.
Okay.
So if you do not get the help that you need, because a lot of people don't take it serious when it's type 1 for some reason, they don't take it serious, period. But it's really serious because you need to have the insulin in your body to help you to continue to operate properly.
Mm.
If you don't have it, your insulin balanced out the way it should be, then you have other problems going on in your body because certain things can't fight off certain diseases or germs that's coming around. So
Right,
everything has
right,
to be
right.
balanced out.
So, we see now a lot of uh, kidney disease resulting from diabetes because it's rampant among African Americans.
Yes.
And it's usually family related. It's usually in your
Inherited.
inherited. It's one of those diseases. So, but I can avoid it. I can prevent diabetes if I eat properly
Correct.
and I exercise and let's see what else.
You
Uh,
eat right and you exercise, but definitely make sure you get yourself checked often because if you're noticing that you're thirsty more often, urinating more often, getting tired, weak, feeling faint, pretty much that's not normal, first of all. So it's pretty simple to just get the test done
mhm.
so we can just check. It's pretty simple, and they can do it in a split, a matter of minutes, and so we can get everything taken care of. But definitely, if it's inherited in your family, it's definitely a thing. I think you should go ahead and get checked.
Hmm. Hmm. But now I got off track, but I was talking about kidney failure. That's really one of the symptoms of diabetes too. When you are not actually maintaining your blood sugar, and
Yes,
you can.
normally people don't pay that part of attention. That's why the urination coming in because they're urinating so much, and they think, "Oh, I drink." You hear people say, "I drink water," but they didn't say how much water that they drink because you may be drinking water, but it may not be enough to keep everything functioning the way it should function. So if you're urinating a lot and you have different doses that may come out in the urine, that's why it's so important to get the test. And you're right, kidney failure would be one of the organs that you're looking at besides a heart attack and a stroke.
Oh, either way, diabetes is a serious disease, and it needs to be. You need to be examined for it. Make
Yes,
sure you get your checkups so that you will know whether or not you have the disease, because not all the time will these symptoms occur like that. You may
correct.
not even know that you have it until you have some kind of episode, pass out or something, and then doctors discover that you have diabetes.
Correct. A lot of people think I am so healthy. I go to the gym, I work out, I eat properly. But like you said, if it's inherited in your family, it's best to go ahead and just. That's the purpose of the question. Once you go to your primary care doctor, they want to know the history of your family. So
Yeah.
therefore, if it's in your family, then they want to go ahead and just continue checking. But if it's not, people feel that if it's not in their family, I don't have to check for it. I'm doing the right thing. I'm eating what I should be eating to help prevent it, but sometimes it's there.
Yeah, yeah.
You have to pay
And
attention.
and another thing too, you need to not be a couch potato. It
Most
helps if you're
definitely.
not a couch potato that you can prevent diabetes. So rather than just maintaining your blood sugar, if you actually uh, do the things that are necessary to prevent this disease, because trust me, you don't want it.
You don't. And you know the biggest myth I hear a lot of people say, if you eat a lot of candy, you're gonna eat yourself and way into being a diabetic.
But that won't do it.
No, when you eat a lot of candy, if you're gaining all this weight and then you become overweight and obese,
Overweight.
now you
Now you're increasing
yes,
your risk
yes,
factors.
not
And
just because you're eating the candy by itself.
right, right. It's actually eating a lot of sugar will not lead to diabetes. It's only
Correct.
if your body is not producing enough insulin or your body is not responding to the insulin that's being produced.
Correct. And if your body is not responding, you would know sometimes you feel a little, kids don't explain it, even adults don't explain it. Every now and then they feel a little pin. Oh, I feel this little tingling in my fingers or in my feet. And mother say, go sit down somewhere. Or an adult's like, ooh, I was standing on my feet a little bit too long. Something to that effect. But you have to pay attention because it's the little signs and the little nudges that you have to pay attention to.
Right,
You
right.
have to
And,
pay
or
attention to it.
you end up with the disease and how did I come here? How did I get that? Yeah.
And once you get it, and you don't have to wait till you get it, start practicing eating correctly. Make it a habit to actually read the labels on whatever you're picking up. Like, watch your carbs. And I always say it's safe to stay 15 and under. You just stay
Hmm.
safe with the carbs and whatever you want to pay attention to. Um, just period, just carbs, and make
Right,
your water, your activity. You definitely need to have a
right.
lot of physical activity to continue to keep going.
That was one of my things I started this summer. I got busy. I did not lie around. I got busy. I did my 2 miles every day. I walked and actually stayed more active than I have been, oh, I
I did
guess
see
in
the tennis
years.
shoes. I did see the
You saw
tennis
my
shoes.
tennis shoes on social
I
media,
did see those
and
tennis
I
shoes.
used them too. I wore out a couple of pairs.
Good for
I
you.
used them, and
Good for you.
I'm still active. I'm still
Good for
moving
you.
around and trying to do at least 2 miles. I'm not doing it every day now. I was running and walking every day,
Okay.
but then I started having some muscle problems, and I'm the old girl is not as young as she used to be. So I started having some muscle problems. So I can't overdo it, but I have to make sure that I stay active so that I can stay healthy. That is one of my goals to because I lost two grandmothers and a father to diabetes.
So it's inherited in your
It's
family.
on both sides of my family. Both of my grandmothers, on my maternal grandmother, my paternal grandmother, both had diabetes, and one went blind from it. Both had strokes. One went blind. Well, one had a stroke. One had a heart attack. Both had severe complications. My maternal grandmother lost her leg to it because she got infection in her leg due to diabetes. My paternal grandmother had blindness.
And those are all the organs they will attack. Those are some of the things that will happen: stroke, heart attacks, and definitely blindness. But also, you have people, and that's why I say watch little children. But also adults as well. If they get a little scratch or cut, and that's another symptom as well. If you get a injury on your body, a cut, a scratch, or whatever, and it's
Uh-huh.
taking longer than it normally would to heal, that's a good thing. I mean, go to the doctor. I know it's just a cut, but contact your primary doctor. Make an appointment because a lot of people don't know. Because if you're a diabetic, it takes a lot longer to heal. And so
Yeah.
you definitely have to pay attention to that as well. And some people feel that if I'm not overweight, I don't have to worry about it.
Yeah. Yeah, that's what I thought too. But because it's in my family,
Yes,
I need to do those necessary things to lower my risk for diabetes.
Yes.
And that's I started taking that very seriously this summer, and that's why I remained active because I really don't want to go through what my folks went through, dealing with this disease. It's such a debilitating disease.
And since the holidays are coming up, and yes, we like to eat, and we don't want to eat ourselves away, but at the same time, some people are borderline right about now, and they want to know. I remember the question being asked of me, can I change? Yes, of course you can always change. Change your eating habit. You don't have to always take insulin. You can actually control what you eat and start eating properly, eat more vegetables and some nuts. Definitely eat something healthy, some grain, some whole grain, so we can start changing some things, and then you'll start changing the levels in your body.
Yeah. But first, you have to be aware.
Definitely be aware.
You have to have the awareness, first of all.
Know
so
your
that's what this
history.
month is all about, November, to be aware of those things that can potentially lead to diabetes. And basically, it's inactivity and not eating healthy.
Stay away from fast food. I know, we love it. It calls us.
It's easy.
It's easy, and normally when it's easy, it's not really good for you. But you're gonna have to actually get some raw vegetables in you, some green vegetables, some, like I said, fruit.
My new thing is I love to make spinach.
Okay.
And I just steam mine, just stir fry it on the top of the stove, and lots of lemon pepper, onions, bell peppers.
I'm getting a little hungry. Okay, but at the same time,
that's my new thing. I've been doing that. And it's not very taxing. You can make it quickly.
You know what? And that will be. I know a lot of people make a lot of New Year resolutions, and I'm gonna lose this, and how about I just give you a little hint? Let's start practicing cooking some vegetables in a way that we normally wouldn't cook them, with all the fatty stuff in them. Try it a different way. That way, it'll be to your taste. And let's kind of bag up off of the stuff that's hurting you.
Right, and it's healthy. Now, I've been cooking with turkey, smoked turkey, as opposed to cooking with ham hocks and
flavor.
Yeah,
that flavor.
It's that flavor,
flavor.
But I noticed that I do a mean vegetable soup with turkey, and I noticed that it tastes cleaner when you use smoked turkey as opposed to using ham hock.
Digest. You can feel the difference in your body. You actually can feel the difference in your body. The turkey, as you said, like you said, it's a white meat also. So it definitely helps. Because red meat, believe it or not, we didn't talk about it, but red meat is something that you want to stay away from if you're diabetic.
Well, yeah, and it takes so long to digest.
So long.
It takes, 36 hours to digest a hamburger or beef, as opposed to 12 hours, 6 hours for chicken and fish. It takes a lot less time.
Red meat. Stay away if you possibly can. I know we love our red meat, our bacon, our ribs.
I will eat bacon in the morning.
If you're going to eat your bacon, just try to do it in moderation.
Yes, I do.
And don't eat 2 pounds.
I mean, 4 strips is not. 4 strips is in moderation, right?
4 strips is not in moderation. If you're doing 4 strips a day, you count the strips up to 7 days. That's a lot of bacon.
Well, I don't do it every day.
Okay.
I don't do it every day.
Well, it'd be really nice if you cut your strips down to 2 and just break them in half, and that makes it looks like 4 strips. I'm trying to help here. Make it look like. Think about it.
Okay, all right, that sounds good. But that's really just mind over matter, right?
Yes, ma'am.
At that point.
Mind over matter, yes, ma'am.
I tell you anyway. Well, the story, our takeaway point from this is eat healthy and stay active.
Correct.
And that will decrease the risk factors for contracting diabetes. And we want to make sure that we do stay away from that because, you get so many other complications.
You do.
That's the problem with contracting diabetes is the trying to maintain and watch everything you eat and you taking your blood sugar, having to prick your finger every day, 2 and 3 times a day.
Deep breathing, and you don't know why. You're deep breathing, and You're deep breathing because your body is not digesting the things that need to be digested. Definitely drink your water along with your vegetables and your fruit or whatever while you're eating healthy. Don't forget the water.
Okay.
It's the key.
All right. Well, we'll come back and review some of those things, but I want to move on and go to epilepsy because November is also Epilepsy Awareness Month, and so we're talking about a group of neurological disorders characterized by recurrent epileptic seizures. You know, a lot of you have probably seen someone having an epileptic seizure and that basically, lose control of their muscles or have no control, have vigorous shaking. And sometimes it's for short periods of time and sometimes it's for long periods of time, this shaking. So, and these episodes can result in physical injuries, including broken bones sometimes, if you have a violent epileptic attack. So, in epilepsy, seizures have a tendency to recur, and there's no immediate underlying cause. So, you really don't know what's causing it.
You don't know what's causing it because, like you said, it's neurological. And when we're dealing with nerves and we talk in the brain and the waves, different things can trigger. And there are so many different epilepsies, so many different seizures. You have the small ones, you have the grand mal, you have different seizures. So it's best to get to your, the doctor so they can diagnose and see why things are going on because there's, kids have small ones, they have large ones. Some people have seizures and don't realize they had seizures.
Right, that's undetectable.
Undetectable
seizures.
Because some people just have small ones and they sit there and they just stare and they don't realize they're actually having them. They really don't. And then when they have them, the short ones, we understand. But then you have the longer ones, you have to really pay attention to the clock and what happens if they lost body fluids and if they can remember those type of things. That you want to definitely get medical help when they're having a seizure a little bit longer than normal, than just a few seconds.
Now, it's really unknown what causes epilepsy, but sometimes it's brain injury that can cause it. Strokes can cause epilepsy, brain tumors, infections of the brain, birth defects. Those are some of the known causes, but generally it's unknown what causes epileptic seizures.
That's why it's important to watch. I always keep saying children, but it's very important to watch when people of all ages have an accident and fall, and if they hit their head. That's so important because if they hit their head, pay attention to them and watch a little bit later if there's other things that happen after they hit their head, and they remember. They go to the doctor a week or two later, and they having a seizure. They are having a seizure, and the doctor said, well, "What happened?" And they don't remember because they just had a seizure, and they forgot to tell the doctor that they fell 2 weeks ago. So it's very important that you watch all kids, all adults, especially the elderly, if they fall. It's very important when it comes to their head because you want to make sure there's not something going on in the head, maybe a little leakage here or there, or something swollen there, or whatever the case may be that caused that. Let's get to the root of the problem instead of just sitting there and then all of a sudden it just came on. If it just came on, you still need to go to the doctor. But if you had an accident before or something happened with an injury to your head, that's something that you may want to tell the doctor as well.
Well, now, epileptic seizures are the result of excessive and abnormal neuronal activity. That's a neurological aspect in the cortex of the brain. And it involves ruling out other conditions that might cause similar symptoms, such as fainting. Fainting will cause sometimes seizures. And so we have an alcohol withdrawal.
Yes,
Those
ma'am.
kinds of things are similar to the epileptic seizure. So the doctors have to rule out those things before they can actually determine that you're having epilepsy or epileptic seizures. So, but there are a lot of people, like 39 million people, that have epilepsy, and 80% of them in the developing world. So, I mean, we're not talking about some kind of prehistoric civilization. We're talking about in developing worlds,
Right.
that people are having epilepsy, and so like 125,000 people deaths occurred in
Seizures.
2015 from the seizures.
Right. I noticed when babies get fevers, and if their fever go up a certain temperature, they have little seizures, but that's pretty much protecting themselves.
Oh
But
yeah, yeah, yeah.
yes,
Now
so
that's yeah.
febrile seizures, the fever, and then you have, like you said, the people that drink alcohol, they have seizures. Then you have people as we was talking about diabetes when blood sugar drop a little low, they kind of like seize a little bit as well. So, like you said, seizures come in different forms, but if there's not a medical condition already, and you just up and have a seizure, it's definitely time to go see a doctor.
And a lot of times now, some people that have seizures will what they call swallow your tongue, or your tongue goes way back in your mouth. And so we were always taught that if that happens, you put something in the mouth, a spoon or
I know
something.
you was taught that, but never put nothing in the mouth.
So they okay.
Yes, even though they tell you put a spoon in there and put your finger in
Or the
there,
one of
don't
those
do
little
it.
popsicle sticks.
Don't do it.
Okay. Okay. But the seizure can make it look like you're swallowing your tongue, or you can bite your tongue, or to the point where it's seriously injured.
And there's another thing: when people see you having seizures, they want to help and they don't know what to do, so they think that it's okay to hold you. You can't hold them. You can actually give them room and move things out of
Do
the
your
way.
thing,
So
right?
give them room and allow it to go on, but definitely keep in mind of the time and when it's done, and when they're, to make sure you pay attention to them. Like, so if they're vomiting or whatever, so you can kind of turn them over to the side so they don't choke or anything like that. But as far as them having the seizure itself, just move objects like table and chairs out of the way so they don't hurt themselves in the midst of seizure.
Right. Now, these jerking activity may start in a specific muscle group and then move on throughout muscle groups in the body.
Correct.
But you will know if someone's having a seizure. You will know by
You
the
will know.
shaking of
The
the muscles,
jerking.
the
The
jerking.
jerking. Correct. And you,
Hmm.
again, you cannot hold them. I know you want to, but you cannot hold them, and you can't stop it. Just if you can, just like I said, move hard objects off around up around them and allow them to be able to go through, and keep an eye on the time just in case you need to go ahead and contact medical attention. I
Okay.
say always.
Right.
I
Right.
say always too.
Yeah. Yeah. Always.
Always,
Always.
always, because
You
what
need a medical
you can't
expert.
see on the inside. Correct.
Right. And so you need to, if you see someone with that, or you witness someone, or yourself even,
Yes,
medical attention is required. So always keep that in
because
mind.
you don't know if a second one is on the way,
Hmm.
and you want to ask them if they remember their
Mm-hmm.
name, the date,
Right.
things
And
of
there are
that
six
nature.
different kinds of seizures that you could have, so you don't know which one you may have had, and they all involve a loss of consciousness and typically happen without warning. You don't know what causes it. It just all of a sudden something comes over you. It's neurological, and you could uh, injure yourself.
Actually, you can injure yourself.
Hmm.
The people that you have, some people have seizures really bad, but they still drive, and you're probably like, why?
Right. That's serious, because if you have one while driving, it's
It
nothing you
takes a
can really
lot.
do.
It takes a lot. You have to go through a lot to get that revoked from you. But they have the
Okay.
right. But yes, you have people that drive. I don't know if you watch news that often, but it has happened. It has happened, and a lot of people drive, and that's their only way of getting around.
Right.
And they have the seizures, and who's going to go get the medication for them? Now, some people can tell when they're about to have one. The ones who have certain seizures, but the
Hmm.
ones who not familiar with their bodies, they don't know.
And after the shaking has stopped, it can take 10 to 30 minutes before the person returns to normal. Normal.
That's why
So,
you watch them and ask them basic questions. You know what today is. You know your name. Do you know where you're located? You know where you're, that type of thing. Just normal questions.
How about loss of bladder control? That also can happen.
Okay, that definitely can happen. And again, we definitely want to get medical attention because it's serious when you're talking about body fluids. Because something shut down in order for that to happen.
Yeah. And I always think about, I had a person that had a seizure while I was in their presence. And it was okay. They were like, no, I don't need a doctor. So it was okay for a minute. But then when there was a loss of body fluids, I was like, nurse.
Right.
Call the nurse right away.
And I always say always because of.
But a lot of times they don't want you to.
Majority of the time they don't want you to.
Right.
But for you and your sanity, call.
Yeah, I did because, I mean, she fell out on me. Okay, fine. You fell out on me. I can, just not move and, and have somebody come along and help lift you up off of me. But when you lose body fluids, that's like a sign of death to me.
Well, we have things shutting down, and
right.
That was just maybe body fluids. Was it both? Either way it go, body fluids, body fluids.
Just the water.
Okay.
Yeah.
So that's serious because that's a part of the brain that gave her the signal to
down,
release.
And the kidneys, then the bladder or whatever.
Yes, ma'am. It's time to make a phone call.
Right. So I was like, okay, call the nurse.
And even if they don't want you to call, allow the professional to come in and take a look and let them make the determination if you need to go, or at least give them that choice.
Yeah.
Give them that choice because it's really serious.
A lot of people just don't like doctors. They don't like nothing personal doctors, but people just don't like to go to the doctor or to the hospital, especially the hospital. And the emergency room is another place people don't want to go because it takes so long.
Well, it may take so long, but at the same time, if you don't go, the longer you wait, the longer it will take. Now, if you wait too long, it's going to be a serious emergency, and you won't have to wait. So then you'll be first priority when you get there. So go ahead and go. Actually, just go to your primary doctor so we can prevent all of this.
Right.
Then you won't have to go.
You do need to be diagnosed.
Well, you definitely could be diagnosed, but that's why when you go to the doctor, he said, was there anything else you're concerned about? Some doctors will ask you that. Even if they don't ask you, just go ahead and say, well, you know what? I was having this little thing going on, like I'm doing, what you call it, the shabby do. The little ticking thing or whatever. Your arms going here and there, your legs going here. Are you feeling a little tingling? It's okay. It probably don't mean anything at that moment, but go ahead and write it down. If you felt it that time or you feel it another time, go ahead and tell them because those are signs letting you know something is about to happen. Don't always be a seizure, but something is going on because it's not normal for you to have tingling sensations just going on in your limbs.
Right. So that's not normal.
Just take notes.
And not just your hands falling asleep or something.
Right. You slept on your arm wrong. No.
Right.
Actually, you wasn't driving a long time. You're sitting there watching TV and not forever as a couch potato, but just normal stuff.
Right.
You just want to take notes, that way you can have something to say to the doctor because by the time you get to the doctor, within those 15 minutes, you forget what you want to tell him or ask him.
Now, many cases are not preventable and there is no real cure. There is no cure for epilepsy, but efforts to reduce head injuries provide good care around the time of birth and providing good care around the time of birth. And those things reduce environmental parasites like the pork tapeworm. How about that, folks? Pork tapeworm may be effective in decreasing the rates of epilepsy.
I wonder about that, and my mind just went other places. I just started visiting babies in my head at that moment and seeing patients. There's so many. If we had a lot more time, and I know we're going to revisit it eventually. I want to be able to bring up a lot of different seizures and epilepsy that we do not. People know about maybe the first 5 or 6, but they don't know there's so many more. That you have little small. You just blank out when you're driving. You're driving. You can see what's around you, but you're actually daydreaming while you're driving, and all of a sudden you snap back to for that split second. And you know where you're in control. You're in control, so you have to pay attention to actually what's going on. There's a commercial out, and I thought it was cute, but it's so right on the money. You're driving, and it's showing pictures of what people's thinking about while they're driving. They're thinking about everything but the road, and just and the cars in front of them. So
that's almost like texting and driving. Right?
Yes, actually, if they could,
accidents can happen in the blink of an eye.
It happens before that, believe it or not. So it's like. That's exactly. We have little small. It's just that when you blink up for those split seconds, we are aware of what's going on, and it's like you have to almost shake your own head to make you focus all over again. So just be aware of. Talk to your family to see if that's also something that goes on in the family. If there's something that we need to know about neurological that's going on. Period. Right, there's a disorder, period.
Now, also relating this to our first topic on diabetes, low blood sugar can provoke a seizure, an epileptic seizure.
Low blood sugar. It sounds weird, but sometimes it's deadly.
Yeah, it can be deadly. Low blood sugar. So if you have diabetes, please maintain your blood sugar at decent levels, so because it can lead to epilepsy,
and you'll be mixed diagnosed.
Yes,
and you will be mixed diagnosed because sometimes you have some people that actually have low blood sugar, and what's too low. When something is too low, it causes other things to read wrong. So if you don't tell them that your blood sugar, if this is normal for you, and your blood sugar is it causes other organs in your body to cut up and act. So if it's too low, then you start having chest pain. Well, you say you're having chest pain, it could lead to other serious stuff. So you have to be aware of your body and what your body normal levels are. You have to be aware.
These seizures, epileptic seizures, can be provoked or unprovoked. Really don't know what may cause them, but sometimes low blood sugar will cause an epileptic seizure, a brain infection, low blood sodium, alcohol withdrawal. Some of these things can cause, and even concussions. Some of these things can cause epileptic seizures.
Every time. I noticed that a lot of kids in the school lately, having accidents or whatever, and that's what's been happening. Head injuries or hit just jarred. Period. You don't have to just hit and shake the brain a little, and it causes other issues. So that's why I say it's very important, because a lot of people don't consider mothers or whomever in the kitchen cooking. You may open the cabinet and forgot you opened the cabinet, and you turn around and you hit your head on it. You don't think nothing about it, but you know it do hurt. But later on, that's very important for you to write down. Right. But sometimes those corners on that door is very important, because you don't know how deep the indent is. You didn't bleed, but that's a deep indent into your brain. Yeah. So head injuries are just not always from sports and car accidents.
Okay, and finally, let's move on to the other health observance during the month of November. That would be Quit Smoking Day, National Quit Smoking Day.
Okay.
So many people still smoke. And now people are smoking e-cigarettes. If you're not supposed to smoke, because cigarettes can lead to cancer and heart disease and so forth and so on, then why would you want to smoke an e-cigarette?
Because they got what they call street knowledge. And the street knowledge is, it's okay to smoke an e-cigarette because it won't harm me like the cigarettes will. But the only thing that should go into your lungs is oxygen.
And that's kind of simple.
If
you're putting anything other than oxygen in your lungs, there will be complications.
Yes, this is something that is made by whatever, and I don't know if it's liquid or whatever they put into these things, and the smoke is totally different from a cigarette smoke. it's thicker, it's whatever, and it's cool looking, so to speak, and
Yeah.
it's not good for you.
And a lot of kids are dying from
It's not
smoking.
cool to die
It's
so
really
young
not.
from smoking.
Right. Enjoy your health, and your health means that you are taking care of your body, and that's what we need to do, is take care of our bodies. I kind of learned about smoking the hard way because I had a heart attack. Didn't realize I was having a heart attack, but and I was misdiagnosed too because my lungs had built up with fluid, and I was misdiagnosed as having pneumonia. Well, of course, I did have a type of pneumonia because my lungs were filled with fluid. However, when they examined the fluid, it was not pneumococcal. So then it was determined that, well, let's see, why is there so much fluid in her lungs? Well, then that was determined that my heart was not pumping strongly enough to pump the fluids out. So,
Is it because some arteries in there was kind of hardening up?
hardening up.
Okay, I was just wondering.
And I had a blockage. Yes, I did. And so I ended up having to have a stent put in. I ended up having to have a stent put in my heart. So then I ended up having to take blood thinners for the rest of my life so that, the blood can pass through. So that's, sometimes we have to learn things the hard way. But I thank God that I'm alive to talk about it and encourage everyone to participate in the National Non-Smoking Day. Quit Smoking Day. And we need to, it's in November, and we need to participate. And don't just do it for one day. If you can do it for one day, you can do it for 1 year, 1 month, 1 year. You can do it for the rest of your life.
Correct.
And after I left that hospital, I didn't smoke again.
Good for you.
I can do something else. I started making jewelry. I started making jewelry as a national pastime. It's
national pastime, okay.
Instead of smoking. So I encourage you to find another habit and replace that smoking with something that's not so dangerous, like making jewelry, running, walking, exercising.
Put the grain of salt
cooking,
out, do something.
Some of those things, sewing, reading, some of those habits are much, much better for you than smoking cigarettes. Try not to put anything in your lungs other than oxygen.
And just for the record, e-cigarettes, it's not good for you.
E-cigarettes are dangerous. So we want to keep you alive and living healthy lives.
For your good.
Why? Because this show is called For Your Good. Thank you so much, our nurse Pamela Davis, for joining us today. And we look forward to seeing you next month. And we don't know what our topic will be then, but we'll come up with something that is interesting and entertaining for you and that will keep you alive and healthy. I'm Myrna Taylor Ransom. You're listening to For Your Good on the WCEG network on WCEGTalkRadio.com. And you can like us on Facebook and follow us on Twitter, follow us on Instagram, and you can also Skype in and when you have comments or questions, and you can talk with us and share your comments or ask your questions. Thank you for joining us, and we'll see you next month.